Now, I'm going to give a little personal thing showing how this heart business fits every one of us listening. And I actually am kind of a doctor of hearts in my office as a psychologist, but this is an example. The year's 2006, and I'm just tired. I go through kind of a week where I have a little nausea, don't feel that good, but it's no big thing. My family physician's in Florida. I happen to run into a friend of mine. I'll even mention Dr. Tim McKenna, surgeon, has nothing to do with this. And he says, well, this isn't like you, John, to be tired. He says, why don't you just pop over to Sparrow and get some blood work? And I said, fine. So I'm over there, and I run into him in the hospital. It's quite a ways from the parking lot to the lab. So he runs into me, and I says, I am just exhausted. So he says, hey, he's got his surgical outfit. He takes me over to the emergency. There's a back door, and he moves me right in there. They do a little testing, and I'd say within an hour or so, I'm with a colleague of Dr. Shah, Dr. Eugene Chu, who actually is putting in 2 stents. And the thing I remember about him, he was saying, oh, this is going so well, Dr. Borracio. I remember thinking to myself, I'd rather have a positive person doing this than somebody who is really negative. So that was positive, even though his partner is a fellow named Dr. Grimm that I ended up seeing. It's kind of an odd name. Was a big hockey fan, Paul, I might add. So I end up with him as the caretaker after that. So anyway, so we do this. I'm back. I'm up in emergency. About a day or so, day and a half later, I'm home. And this is a case, and I did ask Dr. Chu at the time when he was doing this, because you're kind of awake, and I said, by the way, what would happen if I had not come in here? He kind of, I don't know if he chuckled, but he kind of said, well, it would have cleaned itself out. It was an 85% blockage. He said, or you would have had a major heart attack and you could have died. I thought, well, that's kind of a cheerful thought. Let me tell you.
I learned one thing in life, Dr. Borracio. Nice people always finish best. And I think the reason you end up having a stent without having heart attack, because you're just a nice guy.
Well, listen, my goodness, I certainly hope that's true. You see a man who says, think prevention, live long. I mean, that's kind of a positive kind of a view. Well, good. Let me ask you, though, what are things, like I mentioned a few things, like I'd had some nausea, I kind of had a little tightness in the chest, I was kind of worn out. And, of course, these are all signs of the flu. And this was in the winter.
Absolutely.
And now that I look back, when something like that happens, what do you suggest people do?
Absolutely. See, the classic symptoms, Dr. Borracio, for heart blockage would be chest pain, chest pressure, chest heaviness. At the same time, not every person reads a book. So we have to make sure as a physician, as a cardiologist, that we cover all our bases when heart blockage happens. So what are some of the other symptoms? A person who is getting tired easily, a person who is getting very, very quickly fatigued when they do any kind of work, person who is getting shortness of breath, person who is getting jaw pain when they walk, a back pain when they walk. For example, in female, many times they will not get chest pain. They will just get tired or back pain. Diabetics, they don't get chest pain. So just like in your case, Dr. Borracio, when you were getting tired and fatigued, that was a sign of a major blockage in the front artery of the heart. And if you let go of those symptoms, which many patients, many people unfortunately do, that blockage can act up at 2 in the morning. And once the heart attack starts again, there's a 1 in 10 chance of having cardiac arrest. So we want to prevent, by all means, the beginning of heart attack. So we want to catch all the blockage when they are in the early stage, when they are causing symptoms, but the plaque or the blockage hasn't broken, or we call plaque rupture. Plaque rupture hasn't happened, and heart attack hasn't begun. So in your case, thanks to your good friend Dr. McKenna, he recognized the symptoms of fatigue, which many times for physicians are hard to understand that fatigue cannot be left alone. You know, many people say, like particularly in your field, Dr. Borracio, that people say they are lazy, they are depressed, they don't want to do things in life. But before you say that, make sure there's no organic thing, there's no real concern there. And I think that's where Dr. McKenna came in. You know, he's a general surgeon, he's a great friend, but he picked up a heart disease. So who says even a surgeon cannot pick up a heart disease? Believe me.